everyone. Are you tired of that lingering pain that just won't go away? But do you hate the thought of invasive surgery? Well, thankfully, there are options at Non-Surgical Orthopedics. Here to tell us more is MD and CEO Dr. Arnold Weil. Welcome back, Doctor.
Oh, thank you.
So great having you. I was bending his ear in the commercial break. My poor mother-in-law is going through so much with her back. This is something that is such a common problem, and thank goodness there's you. So tell people about Non-Surgical Orthopedics and all the work you do there.
Well, we specialize in non-surgical orthopedics and pain management. So we see a lot of patients with back pain, neck pain, and other orthopedic injuries that many times are afraid that their condition is going to require surgery. So we offer a variety of non-surgical options to treat both a weekend athlete and maybe somebody who's been in pain from a car accident or a long-standing injury.
Right, and talk about the areas that you serve. We have a lot of people in different cities all throughout our area, so talk about where they can come see you.
Well, our main facility is in Marietta, but we have locations in Canton and Carrollton, Georgia. So we really serve a pretty large area of Metro Atlanta, and one thing we've been able to do is get patients in, new patients in within 24 hours in most cases.
Now that's important because when you're feeling that terrible and you're in that much pain, the last thing you want to hear is, oh, our first appointment is in 6 weeks. So
well, we respect people who have pain. They don't want to wait for 1 or 2 weeks to be seen.
Awesome, that's great. And talk about how you're different from other orthopedic physicians out there.
Well, our focus is really on a non-surgical approach. So a lot of times, when you go to a surgeon, they're thinking, how can we help you surgically? But we look at it from the other angle of what can we do non-surgically, whether it be medications combined with physical therapy, or maybe acupuncture, or different types of injections, both office injections, or maybe if you're coming in for back pain or neck pain, interventional spine injections that we can do in our outpatient surgical center.
Terrific. A lot of people watching may think about, of course, the big question, insurance. Talk to me more about that.
Well, we're on just about every insurance plan.
Good.
We see all the commercial insurances. We do workers' comp. We see Medicare patients. We also work with patients who've been in motor vehicle accidents. And for patients who don't have insurance, we have a clinical research department that we do a lot of clinical trials that could offer our patients, which is really nice because if you qualify for one of these trials, you get your medical care free, and in many instances, you also get paid for participating in the study.
That's terrific.
Yeah.
And what conditions do you treat? I know you mentioned just from the weekend warrior who maybe has a bad knee all the way to somebody who's had chronic pain for years.
Right.
Talk about specific conditions.
Well, specifically, we see a lot of low back pain and neck pain, a lot of knee injuries, meniscus, torn meniscus, things that happen, just in a day-to-day fashion. A lot of shoulder, a lot of ankle, a lot of sports injuries. So, we offer, like I said, all these different treatments, and some of the newer things we're doing also is PRP, which is really a great interventional treatment using stem cells, your body's own stem cells, to help promote that healing and regeneration of injured and damaged tissue. That's becoming really very popular in the industry.
Absolutely. It's all I hear about lately, I feel like. In terms of so many different aspects, from your skin to ways to help you with these chronic conditions like this, it's platelet-rich plasma. So who are the best candidates for that?
Well, somebody who's had an injury and it hasn't healed and they have lingering pain and maybe some mild instability in the joint or just a lot of tenderness and chronic pain. And this is a great procedure where we take your blood, we spin it down, we take those stem cell rich platelets, then we inject it back into the damaged tissue. And it's incredible how patients come back feeling so much better.
Really?
With improvement. Yes.
Great results?
Excellent results,
Ah,
yes.
that's so good to hear.
Yeah.
And talk about if anyone's been injured in an accident. Do you take those kinds of cases?
We do.
Workman's comp, personal injury?
We do. We see a lot of personal injury and workers' comp. And we really have a very specialized program for workers' comp and for auto injury patients, because we really focus on not just the pain, but what caused the injury. And I think that's really where we stand apart, is we try to look at and determine what caused the injury, where the injury is coming from, and what areas is causing the pain. And we treat that. We don't just treat the symptoms, but really try to treat and correct the problem.
And go back to a point you made about the research that you're able to do. Tell me more about your research department, because it's pretty incredible to think that somebody who maybe doesn't qualify, as you mentioned, could go through that trial with you and get the help that they need. How is that possible?
Well, we work with a lot of pharmaceutical companies and a lot of other research companies that develop these trials, and then we participate in the trials. So many of them are on medications that are already have been out in the market and been used for many years, but they're looking to see how they may be effective in other indications. And some of them are actually technologies and things that aren't quite out yet. So we're able to offer these to patients, and they get firsthand experience on going through the study and keeping documentation and seeing if the medications or maybe the injections can help them. And again, the benefit is they don't have to pay for this, and a lot of patients that really can't afford medical treatment now can participate in these studies. Yes,
absolutely. Dr. Weil, thank you so much. Great seeing you
again.
Yeah, thank
you. Good to see you.
As always. And where can we go to learn more? Website, phone number?
Lowbackpain.com, 770-421-1420.
And just because I can, I'm going to say it again. That number is 770-421-1420, or log on to, as he just said, lowbackpain.com. And this segment was paid for by Non-Surgical Orthopedics.